She Who Awakens by Alina Chamberlain. Book 3, Chapter Intimacy During Pregnancy and the Postpartum Period. Navigating intimacy during the journey of motherhood is one of the most delicate phases in a woman's sexual life. In professional sexology, we view pregnancy and the postpartum period not as interruptions to sexuality, but as unique physiological states that require adaptation and psychological maturity. Whether you are carrying a child or recovering from childbirth, maintaining a sexual connection is vital for hormonal balance, emotional bonding, and the long-term structural integrity of the partnership. The prenatal phase, pregnancy as a catalyst for vitality. Unless there is a specific medical contraindication or a high risk of miscarriage, pregnancy is not a disease. It is a state of heightened vascularity and hormonal abundance. Engaging in sexual activity and achieving orgasm during pregnancy is not only safe, but physiologically beneficial. Fetal benefits. During orgasm, blood flow to the uterus increases, significantly boosting the oxygen supply to the fetus. This surge in oxygen and beneficial hormones, such as oxytocin and endorphins, supports the healthy development of the baby's nervous system. The mother's response. Many women experience increased sensitivity and lubrication during pregnancy due to pelvic congestion. This is an ideal time to explore tactile pleasure and solo masturbation. Positional adaptation. As the pregnancy progresses, comfort becomes the primary consideration. Lateral, side-lying positions are generally recommended to avoid pressure on the abdomen, while allowing for deep intimacy and clitoral access. Refusing sex based on the myth that it harms the baby is a psychological barrier that can lead to unnecessary distance between partners. The postpartum recovery. Navigating the libido gap. The year following childbirth is a recognized period of sexual crisis, characterized by profound hormonal shifts and the reorganization of family life. The prolactin effect. During breastfeeding, high levels of prolactin, the hormone that sustains milk production, naturally suppress estrogen and libido. It is normal to feel a decrease in spontaneous desire during this time. Structural recovery. Childbirth naturally stretches the pelvic floor and expands the vaginal vault, which can temporarily reduce physical sensation and the intensity of orgasms. The training protocol. To accelerate your recovery, begin pelvic floor training, intimate gymnastics, as soon as you are medically cleared, typically 3 to 4 months postpartum. Strengthening these muscles increases blood circulation and restores the snugness required for friction-based pleasure. Preserving the couple's bond. Avoiding the third-party trap. A frequent clinical observation is that sexual neglect during the first year of a baby's life often leads to long-term relational dysfunction. Maintaining the erotic anchor. Even if your desire is low, it is crucial not to shut down the sexual center of your brain. Providing manual or oral pleasure to your partner maintains the safe signal in the relationship. When a man feels sexually excluded, he may retreat into maladaptive masturbation or seek external validation, infidelity. By staying sexually active, even without achieving a personal peak every time, you keep the father of your child invested, protective, and helpful. The sleeping dynamic. Avoid the trap of the fragmented family, where the mother sleeps with the child and the father is relegated to another room. This physical separation is a primary trigger for emotional distance and conflict. Breastfeeding duration. While breastfeeding is essential for the baby's immunity and bonding, best recommend a balanced approach. Extending breastfeeding beyond 1 year can sometimes be used as a subconscious way to avoid returning to a full adult sexual life. Aim to transition toward year 1 to allow your hormonal baseline and sexual self to fully return. Discover the secrets to nurturing your lifestyle and love style at Wish for Love. The electronic version of all chapters from the full book, She Who Awakens by Alina Chamberlain, can be found at wishforlove.org.